Sanjay.
Going live in 3, 2, 1.
And welcome to our final fifth surgery of the day. Shot. This patient comes to us with back pain that is severe. And when I asked him, where is your back pain? He pointed to his lower back, right where the L4-5, L5-S1 was. He's also got pain in both legs. When I looked at his MRI and where he was pointing, I realized he's pointing to his L4-5 and L5-S1 disc. Shot. Shot. And when I looked at his MRI, I saw, Shot, that his disc was definitely injured, damaged at L4-5 and L5-S1. Shot. So I told him, we need to fix your discs because I think that's where your pain's coming from. And he agreed. Shot. So we're going to be fixing the L4-5 on both sides, Shot, and the L5-S1 on just the left. You're doing great. Hang in there. Num num. Go ahead. Yes. Let's show our audience, Sanjay, why do herniated discs cause so much pain in some people?
Copy that.
The answer is inflammation. Shot? Shot? He showed me this area right here in his back. And I looked on his MRI and there were two discs, L4-5, L5-S1. L4-5 had annular tear on both sides with herniation on both sides. And the L5-S1 was really off to the left. But I knew these were the cause of his pain based on my experience in treating thousands of people and eliminating their pain with this procedure. So I said, I think this is the way to go. He's here now to get his surgery done. Are you comfortable?
Can you open your eyes for me? Can you open your eyes?
Are you having any pain?
Having any pain anywhere? Any pain anywhere, sir? Yes or no?
No?
No.
All right. Ooh. Did you see that? That's pretty funny. It shot right out on my side. All right. Not yet. How bad is that on a scale of 1 to 10?
Give us a number.
How high does it go?
What'd you call it? 10?
10?
You said 10.
Is that where you typically get your pain? Yeah? All right. Good. So we know that the L4-5 is a 10 out of 10. Is that better? Guide wire. He's still a little sleepy, but he's giving us some groggy answers. But we want him comfortable. At the same time, we want to know how bad this discs are hurting him. Look at him tighten up. How bad is that on a scale of 1 to 10?
You said 10.
All right, all right. Is that where you get your back pain? Let's put him to sleep. Great news. So we know where the pain's coming from, shot. It's coming from both L4-5 and L5-S1.
Okay.
It was concordant, and it was 10 out of 10 at both levels. You guys get that? So we know for sure that this is going to fix his back pain at those two discs. Num-num? Num-num? All right, we're giving you more medicine, that's all. Any questions from the audience?
No questions.
All right, relax. You're doing great. Uh-huh. All right, let's go ahead and show the audience how the Duke laser disc repair fixes back pain from a torn disc, a painful disc. Will you count out loud from 1 to 100? Keep counting. That's just medicine going in your arm. Keep counting.
Playing educational video in 3, 2, 1.
All right. Long days, not enough oxygen to the brain. It makes for some really entertaining moments. Our patient is comfortably asleep, and we're getting ready to start fixing the first disc. I don't have any irrigation coming out. I don't know if there's been a recall on irrigation. All right, now it is. Okay, anybody have any questions as we go down to fix the first disc of 2 discs with 3 injuries, 3 tears? Look at that thing. Look at that herniation. Laser. Any questions from our audience?
No questions.
All right, thank you, Sanjay. You are live streaming, right?
Yes.
All right, good. Just checking. What's kind of cool is you can actually see the needle from the other side right there. You guys see that? I really don't want to hit it too much because it'll literally melt the steel, which I think I've already done. Look at how it's melted the steel. Are we okay?
Yeah.
Is it moving?
Yeah. I actually moved.
Look at the tear right here next to the needle. See the tear that I'm in right now? So, oh, God, look at how can you separate the two? All right. Yeah, look at that, guys. Just people ask me, can you remove bone spurs? We can melt metal. I mean, not intending to, but it happens. This laser is extremely powerful. It actually, I broke it once, the fiber, right when I was hitting it, pedal was on. And this was back, probably 16 years ago when I started doing these. And can you pull it back just a little bit because it's kind of pushing my fiber where I don't want it. Man, what a tear right there, huh? All right, there's more tear right there. That is the needle from the other side. Look at the tear. That's the tear we're here to fix. You see the blue stuff in the tear, that is the herniation. We want to get rid of that. Getting rid of that will let this disc heal. It will become painless. I'd like to do it without melting any more of that needle. All right, any questions from our audience?
No questions?
Pretty cool, huh, Sanjay? You see how the needle gets melted with the
Yes.
laser.
Yes, I do.
Okay, there we go. Well, this is a tear at the bottom of this disc. You can see where the tear is down here. And you can see some healthy annulus above it. And this is all herniation stuck in the tear. So I want to clean all this out. We call this an annular debridement. It's unique to the Duke laser disc repair. Other surgeries don't do annular debridement. There is no CPT code for annular debridement. Not yet. Huh? Why do you say that? Oh yeah, instead of fusion. True. It's always better to do a debridement than a fusion. Most doctors can't do it though. They don't know how to do endoscopic surgery. To be able to do a debridement, you have to do endoscopic spine surgery. As a matter of fact, you have to do specifically transforaminal endoscopic spine surgery, which is what we do here. If you do endoscopic non-transforaminal, you're not going to be able to do it. What's becoming very popular right now is this uniportal UBE, bilateral endoscopic stuff they're doing over in Asia. It's supposed to make it easier for the surgeons, but I don't think you should make surgery easier for the surgeons. I think the surgeons need to become better and do a better job for their patients. Honestly. You don't make the surgery easier for the surgeon, you make the surgery better for the patient. Am I missing something here? That just shows you how egocentric doctors can be. Hey, let's make the endoscopic surgery easier for us. It won't be as good for the patient, but it'll be easier for us. Right? just trying to figure out where that other needle is.
I gotta remind myself to talk to you about a case that we have on Friday.
Oh no. What do you want to talk about?
I was just thinking about maybe doing DLDR first, and then doing the cervical on Friday. The only reason is bone position with the collar. I just want to go.
Lights on, please. Thank you.
Do what?
I was concerned about bone position
Scope
with
off.
the collar on. That's why. It's a little hard for you sometimes.
I don't understand, but what? It's a DLDR plus a DPR.
It's a DLDR cervical and then a DLDR lumbar, and they're 2 different days.
So what? He's getting one on Friday and one next the week.
On Friday is going to be the DLDR lumbar, and I was thinking if we switched the order, so
Yeah,
would it be okay for
of
you?
course.
Okay.
Yeah, whatever. I mean, safety comes first.
I was just thinking, I feel more comfortable seeing without
Safety comes first.
the collar.
Yeah, I know what you mean. I think that's fine. Just talk to the patient. Let him know that's what we're doing.
Did you hear that, Sarah? Yeah. You don't do your cases. You should probably do the cervical last, the second part of it.
We'll do the lumbar Friday.
Yeah, no, to do the cervical on Friday.
No. Oh yeah, cervical Friday.
I don't have to sedate them.
Yeah, and then lumbar the following week.
I didn't really hear what you give a little jump for us. I'd rather do it without the cervical collar.
Yeah. But the second procedure is next week.
No, it's all the same week.
I mean, no, I thought it was this Friday.
Yeah, yeah, I mean, it's the same week. On Thursday,
And you want to change the order.
of course, I'd like to do the last good part of the procedure would be the cervical on Friday instead of the lumbar on Friday.
Yeah,
Does that sound okay to you?
it's fine with me. Whatever you think is safer and better for the patient.
So you hear that, Sarah? We gotta work on changing it. Maybe we should talk to Sheena or talk to someone else.
Shot. Hold on, hold on. All right? Yeah, take it out. No worries. All right, so far everything's going very well for this young man. We are working on the L5-S1. I think that's in, right? Try pulling it back a little. Yeah. He's doing fantastic. You can see it's only a 7mm incision. The whole surgery is done through a tiny little cut. Really no bleeding, no hospital. We've not had any serious complications from the surgery. And it's outpatient. Patient's going to go home shortly after the surgery. Scope on. Uh-huh. Okay, laser, blue towel. Uh-huh, I got it. Nice. I don't know if we're broadcasting. I'm just operating. Either way, broadcasting or not, I still have to operate.
So after cervical delivery, you like to call on for a full 6 weeks while they're sleeping for supine.
Yeah.
I just want to make sure.
Yeah, what happens if they re-herniate? They have to come back and get another surgery done. So. See how swollen the disc is? It was just really bulging out. A lot of water. Edema, we call it. Look at that. Herniation. See the scar tissue forming on the surface already? There's one day I'm not going to be here, right?
Yeah, next week you're.
Next what?
Thursday and Friday. So that's why I didn't do the cadaver tap next week. So.
Yeah, that's fine. Give everybody a break. I'm going to move my son into Princeton.
That sounds exciting.
Yeah. Well. You're going to meet his roommates and make sure he knows where the library is. Right, Bernadette? Louise? Uh-huh.
Do they even use libraries nowadays?
I do. I mean, I love the library. God. The library is the best. If I had to go back to med school or university, I'd be in the library. That's the best place to go to get away from everybody. There's no distractions.
University of Miami had a beautiful one.
Miami?
It was great.
You said you mine? Miami?
I like at University of Miami's
Yeah.
library, the med school library, a lot.
Oh, med school, yeah.
Yeah, med school library is really nice.
I haven't seen that one. I saw the undergraduate. It's very nice. Oh, yeah. Nice campus.
But you think your daughter's going to go to Gainesville, right?
Who knows? She could end up in Miami. I think she'd be happy in either place.
You're probably a little closer to Gainesville, right, than Miami. I guess driving.
Yeah, but she's got to get in. She's very smart, but she didn't really apply herself. And when you don't apply yourself, you can be very smart and you're not going to do well. I hope. But if she doesn't, then she'll have to learn her lesson and hopefully become a better person, smarter, wiser person, you know, and next time not make that mistake. She wants to be a doctor, but I told her if you want to be a
It's a nice school local, too. It's really nice, right?
FAU,
Yeah, it's very nice. It's not too big. It's not as big as those small, smaller places.
yeah.
It's good for pre-med. Really good. They have a med school there too, right there.
All right.
I mean, I'm just saying.
No, I'll talk to her.
Just a recommendation.
I just don't know that she's going to. Absolutely. Look, you're working at Duke Spine Institute. You got the best anesthesia job anybody could get. Right?
Yeah, and it gave me a good career too.
What are you talking about?
7 years.
You're at the peak of your career, buddy.
27? I don't know. 27.
You're at the peak.
27 to go. I remember you said to me, hey, you and I need to retire on the same day or something.
Yeah, that's true. Why not? I'll probably die in the operating room. You guys will probably get a crash cart for me.
I don't think that the defibrillators are trying.
It's just that I love doing what I do. You know? There's nowhere I'd rather be. This is so exciting for me, you know, doing this stuff. All right. I think that's about it. All right, we're going to go do the other one and we'll be done. No DPRs this one, right? Looks good, about 3 millimeter hole. See that, Luis? Oh yeah. You know, you should ask him. I honestly don't know. It's a great thought. A lot of these guys, yeah, that's it. No way. Private equity owns anesthesia. I didn't know that. Why? I didn't know anesthesiologists made enough money for other people to take.
We have a comment from Sarah on
I'm sorry?
YouTube.
Oh, you have a question from somebody? Comment?
A comment from Sarah.
Yes, please share the comment.
I cannot get proper surgery for my L4-L5 herniated disc.
Yes.
I wish I knew how to upload an MRI and send it.
Well, you know, it's easy. If Sandra, if you could just type the link, it's mri.dukespine.com, mri.dukespine.com. If you click on that link, then you can, shot? Yeah.
Copy that.
Then you can, you know, fill out your information, and we can review your MRI. Now you're going to have to send the MRI to us by mail. Shot? You can feel the herniation. Time to push it back in. Shot. All done. Last one. We got 10 minutes left. If you have questions, type them up. I'll answer them before I leave. Everyone's done a great job today. Thank you, Sarah. Sarah's our DON. She's top brass. All right, great. Let me know when you get the response from AAAHC, please. Perfect, thank you.
Scope on, please. Thank you.
Great questions and comments. Our MRI review is free. We don't charge. We want to help people get a better understanding of what's wrong with them and how it can be fixed. So we realize most people won't be able to come here fix, but someday maybe they will. Okay, now I'm on the other side of the disc. Remember we saw the needle earlier coming here, and now took the needle out and we're inside the right side of the L4-5 disc. Is he okay?
Yep.
We'll be done in 10 minutes. Looks like we mangled the plastic on the end. See that? Luis?
Huh?
Look at the plastic.
Oh, yeah.
What happened? It's okay, I'm sure.
Oh, it's burned, yeah.
How did that happen? Right?
Weird,
It's unusual. All right, any questions for our team?
No questions?
See the granulation tissue? Grabber.
Jordan, can I help? What he's looking for? Staples. Yeah, yeah. What he's looking for? No, no, staples. Oh, no, no, no. I think we can.
At one point we'll have to strip it. Before the next case with it.
Oh, this one?
Yeah.
Oh, yeah, yeah. Already fixed with that. Ready, please? Press ready. Ready? Ready?
Press ready on the screen.
Yeah, yeah. No, you're good.
That's
you're
all
good.
right.
You're good. Good.
Thank you.
Thank you very much. Yeah. My English, right?
How's irrigation? Grabber. Less than 5 minutes. 1 minute.
Lights on, please. Thank you.
Great job, everyone. Thank you so much for your help today. We got a lot of people helped, and I'm happy about that. All right, Sanj, you can end the recording and broadcast. We're
Copy
done.
that.
You can see how small the incision was. 7 millimeter, I got it.
Yes, I do.
Give us a countdown. Go ahead, Sanjay. Terminate. We need to
Go.
hear you.
Going offline. In 3, 2, 1.